Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Now we will be studying an important topic of osteomalacia. Okay, now we will be studying about the osteomalacia. From osteomalacia, you will be getting a short note. So just read this topic that it will be asked as a short note, not a long question. See, if it is asked as a long question, then it will be asked in an integrated format. It will be a 3-mark question or a 5-mark question or a 2-mark question, not more than that. Okay. Next, osteomalacia. What is osteomalacia? Osteomalacia is softening of bone. Softening of bone. Why? The bone softens due to bone mineralization. Okay. Osteomalacia. In adults, it is called as osteomalacia. Or if I say bone mineralization defect in adults and in children. So in adults, it is called as osteomalacia. And in children, it is called as rickets. If you are having any difficulty in memorizing na, just remember AA. A means adults. Does rickets have any A? No. So it's in infants or children. Infants or children. Okay. This you need to remember. What is the main cause? So main cause is due to the vitamin D deficiency. It is mainly due to the vitamin D deficiency. First, let's just talk about the normal bone mineralization. It requires calcium, phosphate and vitamin D. So you have osteoids. Osteoids remains unmineralized in the bone matrix and they're produced by the osteoblast, right? So there is a proper mineralization that converts, that basically what it do, it converts the osteoids to hard bone. It converts the osteoid to a hard bone, right? If I talk about the pathogenesis, the first pathogenesis is due to the vitamin D deficiency. If there will be a deficiency of vitamin D, there will be decreased in the calcium, there will be decreased in the calcium absorption that the bone, it is very, very essential for the bones to help. It is essential for the bones to grow, right? Next is if there is hypocalcemia. What can occur? There can be secondary hyperparathyroidism. Next, if there is increased bone resorption but defect in the mineralization, there is increase in the bone resorption but there is defect in the mineralization, so it will lead to the defect, right? Second is if there is accumulation of unmineralized osteoids. So what will happen? It will lead to the formation of soft bones, and soft bones are very, very fragile. They will be very, very fragile for any kind of disease to occur. They, even if I hit the person, even if I punch the person, their bones are very fragile. What will happen? That person will cry a lot firstly. Then there will be injury to the bone and it will take some time for the bones to heal, right? So their bones are very, very fragile. First one, what are the causes? Inadequate sunlight. Okay, the patient is saying, no, I will just get tanned if I go to the sun, if I step out of the house, right? So tell that person that, dude, I am just asking you to step out of your house to take some sunlight just for you, so that you don't develop osteomalacia in your near future, right? So tell that to that person and explain the scientific reasons behind that. Second one, if there is poor diet, if the person is consuming junk, if the person is on pizzas, coke, and whatever you guys eat, right? So it's always advisable to go for a healthy diet. Always advisable to go for a healthy diet, right? Second is malabsorption syndromes like your celiac disease. I have already told you. So celiac disease, you have to advise the person for the gluten-free diet. Gluten-free diet. Okay. Then you have the Crohn's disease. Crohn's disease have skip lesions, right? It is the inflammatory bowel disease. Right. Next, there can be renal disorders like your chronic renal failure, and chronic renal failure, if not treated, will lead to the end-stage renal disease, right? Drugs can be like phenytoin and phenobarbital, and there can be tumor-induced osteomalacia. For that, you have a gene mutation, that is FMGE mutation, that is responsible. Okay. Next that you have is the vitamin D metabolism. So for skin, you have the 7-dehydroxycortisol. It gets converted to your vitamin D3. In liver, it is converted into 25OH and D. Then you have in the kidney, and then the 𝗲𝗵 increases the calcium and phosphate absorption. This much you need to know. At our level, it's just enough. Okay. What are the pathological changes? There can be excess unmineralized osteoid. Okay. Then they can be widely and poorly mineralized. On X-ray, you will be able to appreciate in the looser zone the pseudo fractures. Now you will ask me, ma'am, what is this looser zone? I will tell you. Okay. We will study about that also. For the clinical features, there will be diffused pain. The person will be having pain in the ribs, hips and spine. Ribs, hips and spine. Okay. Muscle weakness, there will be proximal myopathy. Proximal myopathy means your proximal areas. There will be fractures and deformity, and there will be waddling gait. You know how a duck walks? Like you have seen Mickey Mouse, I guess. You know the Donald Duck, how the Donald Duck just do the waddling gait like 1, 2, 3, 4. The pregnant women also walk like a waddling gait only. Okay. Next is the radiological finding. In the looser zones, there will be pubic rami, ribs, scapula and femur. These particular things will be having the looser zone. There will be decreased bone density. I have already told you. There will be biconvex vertebra like the fish mouth appearance. Like these are your vertebrae. Okay. See over here. This is nothing but your fish mouth appearance. This is nothing but your fish mouth appearance. In the laboratory, we are able to see there is decrease in what? There is decrease in calcium and phosphate level and phosphate levels, and increase in ALP and increase in parathyroid hormones, right? So these are the things that you will be able to appreciate in your laboratory finding. What are the diagnoses? In blood test, you have to see the calcium, phosphate and ALP and vitamin D. In X-ray, you will be able to appreciate something called as a looser zone. And when you do the bone biopsy, you will be able to see that there is unmineralized osteoid. Then you have to do the urine test for your calcium and phosphate. What is the treatment? You have to give vitamin D supplements, then you have to give the calcium supplements and treat the underlying cause like the renal disease. Because if not treated, it can lead to the end stage renal disease. If not treated, it will lead to the end stage renal disease. So it's important to treat it, right? Next, for the prevention, ask the patient that, see, you will not get tan, just go and get some sunlight, right? So you have to give the person adequate sunlight exposure. You have to maintain a balanced diet. Then you have to give the routine supplementation. Routine supplementations of what? If the person, you have to ask the patient that if you are not taking a proper amount of diet, at least just take some vitamin D supplements, okay? What is the prognosis? It is good with early treatment. If untreated, there will be bone deformities and fracture. Bone deformities and fractures can happen if they are not treated. Now, the next thing that you need to know is about the difference of osteomalacia and osteoporosis. So, osteomalacia is a defective mineralization. There is increased in the ALP levels and there is bone pain. In osteoporosis, there is loss of bone mass, normal ALP and minimal pain, right? In the summary, if I talk about osteomalacia is defective bone, it is a defective bone mineralization due to the vitamin D deficiency that you need to remember. It presents with bone pain, weakness and fractures, diagnosed by low calcium level, phosphate and high ALP levels, and it is treated with vitamin D and calcium. Okay, this was all about this chapter. If you are having any sort of doubt, please feel free to ask me. Please feel free to DM me. Thank you so much.